Hi, welcome to this session on telemedicine. We will cover the different aspects of telemedicine as a medical practice. We will try to understand what exactly is telemedicine, what goes into telemedicine, what are the different elements, how do we actually ensure that we practice according to the MCI guidelines and the laws pertaining to telemedicine, how do we utilize telemedicine in our hospitals and in our medical practices, and last but not the least, how do we choose how to practice with a better platform. So let's dive directly into what exactly is telemedicine. So in the last 3 months, there has been an unprecedented interest in telemedicine. What has driven this are three things. One, MCI guidelines were published on how doctors can utilize telemedicine. This created clarity in the environment about the legal parts of telemedicine. Doctors were able to understand that this is how MCI wants us to practice telemedicine. Second thing that happened was patients' acceptance. Patients started accepting telemedicine as a very easy, comfortable way of connecting to doctors and getting treated. So they didn't have to travel and they could manage their diseases and their health sitting right at home. So there was great interest from the patient and acceptance by them. And because patients accepted it, doctors also started using telemedicine. So three things have happened. One, MCI came up with the guidelines and the laws pertaining to telemedicine. Number two, patient acceptance went up. Number three, doctors' use went up. So all the three combined to create an unprecedented interest in telemedicine. Unfortunately, telemedicine has got skewed towards only one part, which is teleconsultation. But telemedicine is not really just teleconsultation. So to put it simply, telemedicine is providing treatment and care to the patient from a distance by a healthcare provider, which is a doctor, using communication and digital technologies. It's very simple. Treating patients at home using digital and communication technologies. Now, based on this, we must understand that there are some confusions in the market, in the environment. Telemedicine is not e-commerce. So telemedicine is not about producing or is not about providing medicines at home. Telemedicine is not about selling tests online. Telemedicine is actually a serious practice of medicine which involves patient care, patient treatment, patient monitoring and advice by a doctor. So we have now understood what are the different aspects of telemedicine. What exactly are the benefits? So I'll quickly go through the benefits for both doctors and patients. For patients, it's very simple. They are able to access the right treatment at the right cost. So they can access specialist doctors from their small towns and villages. Specialist doctors are generally concentrated in bigger towns and metros. So now through telemedicine, you can actually access them and get consultations. Number two, it reduces their cost substantially. They don't have to travel, they don't have to stay. Therefore, the logistics cost, which can be up to 30 to 40% of their total healthcare cost, is reduced. Number two, it improves their compliance because they are educated better, because they will get instructed better, which is something that I will show you. Their compliance is improved and therefore their clinical outcomes are better and hence their health is far better than what it could be. So net benefits for patients can be put into three. One, access the right doctor. Number two, reduce cost. Number three, live healthier lives. What's the benefit for doctors? Now, doctors actually can access more patients and therefore increase their practice. So their volumes can go up, they can grow their practices well. Number two, they can educate patients better, they can monitor them better and therefore improve the clinical outcomes. When the clinical outcomes goes up and is better, naturally the patient satisfaction is great. So there is a great improvement in the doctor-patient relationship. And when the doctor-patient relationship is great, naturally the doctor's practice goes up. So for the doctor, in a nutshell, one, it gives them increase in their medical practice by accessing more patients, by getting more word of mouth referrals. Number two, their clinical outcomes go up and patient satisfaction definitely improves. So all the three actually are great benefits for doctors. Now, we move to the next part, which is what about the law and what is MCI talking about? Now, this is a big subject takes a lot of time to cover, but I will just give you the gist in the next 5 minutes. So what is the gist of the MCI guidelines? So MCI guidelines are meant to protect both the doctor's interest and the patient interest. That is the interest. That is the outcome that the MCI guidelines actually create. So what are they talking about? Basically, a doctor has to look after 4 areas. 1, ensure that identification happens properly, consent is taken, prescription is legal, records are maintained. So these are the 4 major areas, and I'll delve a little deeper into this. What does it mean by identification? So identification is giving the patient the ability to choose their doctor properly. So which means that the patient cannot go to a platform, pay, and then the platform gives them some doctor whom they did not know or whom they did not choose. So MCI guidelines make it very clear that the doctor's name, their qualifications, experience, etc. should be made available to the patient before they make a choice. So identification of the doctor is important. Similarly, the doctor should ensure that the patient is identified properly. In case there is a problem later, they are able to identify that this is the patient whom they treated. So this is as far as the identity part is concerned. The second issue was consent. Now, as far as MCI guidelines are concerned and the law, I suggest very strongly that patient's consent should be taken and recorded somewhere. Why do we need to take patient's consent properly? Is because patients need to understand that this is teleconsultation and physical examination will not happen. So in the consent, we need to ensure that they give consent for that the advice and the prescription that will be provided to them will be on the basis of their history, the visual clues that the doctor is able to pick up when they are doing a video call with them, and on the basis of the investigations and reports that the doctor sees. So this consent has to be there. Otherwise, there could be a problem later. The patient can say, I did not know that in a teleconsultation the doctor will not examine me. So this is something that is important. The third part is prescription. There are 2 parts in the prescription. Number 1, the prescription has to be legal. When we say legal, there are MCA guidelines that tell us exactly how a prescription should be written. And of course, it also has to do with the Drugs and Pharmaceutical Act. So in that, the prescription has to have certain parts. 1, the doctor's name, their qualifications, their registration number, and their contact details have to be there. This is what the MCI says. Provisional diagnosis has to be written. Date has to be there. Last signatures have to be there. So these are very important parts of a prescription. Any prescription that does not have all these elements in them is an illegal prescription and the doctor can be in trouble. The next part is what can you write? Are there any restrictions on the medicines that you can write? So there are some restrictions. One blanket restriction is that there are scheduled X drugs. So MCI very clearly stated that Schedule X drugs, which are actually narcotics and other such drugs, they should not be prescribed. Very clear. Then they have divided the kind of drugs that you can provide, that you can prescribe under different categories. One category is that your patient has come to you for the first time. You can actually prescribe certain drugs to them, which are over-the-counter kind of drugs. If the doctor is confident about the diagnosis, then they can also prescribe antibiotics and other medicines. So this is one kind of patient that comes to you. Second kind of the patient is a follow-up patient. Now, what the MCA guidelines say is that there is no restriction on what you can prescribe to a follow-up patient because you actually seen that patient and have treated them. However, they are saying that within 6 months, the patient should actually come back to you. So which means that up to 6 months you can, prescribe anything that you want. But after 6 months, it will be good if the patient comes and gets a physical examination by you. In which case, then you can write, for the next 6 months, you can write any other medication. So this is the restriction as far as follow-up consults are done. There is no restriction on antibiotics. Even now, they are included psychotropic drugs also for use in psychiatric medicine. And what MCI very clearly states is the principle. The principle is to, 1, these guidelines are not set in stone. So they will change as feedbacks comes to the MCI authorities. They will change the guidelines. And number 2, the doctors must use their clinical acumen to prescribe. If you are not comfortable, do not prescribe. Ask the patient to come to you. So this is as far as the prescription is concerned. So we already covered three things. One, we talked about identification. Number two, we talked about consent. Number three, we talked about prescription. Last but not the least, which is most important, are records. Now, under MCIA has very clearly stated that records is a very important part of teleconsultation. So when we talk about records, what we are saying is you must record all the logs, that is when the consult took place, the time, date, etc. Number two, you must have all the prescriptions that you wrote as a record. Number three, you must ensure that everything that went into the consult, that means all the patient's investigation, all their reports, all their x-rays, everything that went into making that clinical decision has to be recorded by you and kept in with yourself. So record maintenance is very important as far as teleconsultation is concerned. So to conclude, MCI guidelines are focused on teleconsultations, and in which they're talking about four major areas: identify, take proper consent, prescribe legally, and maintain records. This ensures that you are safe. Now, we said earlier, telemedicine is about providing treatment and care to patients from a distance. So is teleconsultation the only element of telemedicine? I'm afraid not. Telemedicine has got more elements. So let me explain to you what other elements are there apart from teleconsults. So there is something called patient engagement. That's one major element of teleconsultation, which we will talk of telemedicine, which we will talk about now. The next element is patient monitoring, and last but not the least is screening. And then there are some specific elements which can be used by specific specialties for telemedicine. So telemedicine is not just teleconsultation, but it is actually monitoring, patient engagement, screening, and some specific use cases. So let's delve into that now. What do we mean by patient engagement? Now, when we talk about patient engagement, we are saying that patients, when they come to you, especially now that they have chronic non-communicable diseases, chronic ailments which don't get treated, they need to know more about their disease. The purpose of an NCD management is not to cure, because these diseases are not curable, but to ensure healthier outcomes. Patients live healthier lives free of complications. How does that happen? That happens by 3-4 major things. One, patient needs to comply with doctor's instructions. What are these instructions? They have to take medicines properly in the right dosage at the right time. This is important. Number two, they are not supposed to miss medications. Number three, they are supposed to undertake some lifestyle changes, which could be in terms of exercise, it could be in terms of diet, it could be in terms of activity. So there are some lifestyle changes that every patient has to undergo in order to live a healthier life. Now we all know that we struggle with patient compliance issues. So doctors across the world say that there is only 50% compliance. How can we improve compliance? And this is where patient engagement, monitoring actually come in big time. So you can actually help to improve the patient to comply by using this element of telemedicine. So imagine patient comes to you with diabetes. They want to know more about their disease. They want to know what is diabetes, what is this sugar, what is carbohydrate. So there's a lot of patient education that goes in. Now I know that there are different agencies and even doctors who hire diabetes educators to provide this education. But imagine this education coming to you in very simple language with a lot of visuals and coming on your mobile phone at intervals, so that you take bite-sized information and absorb it, and you can always go back to it. So this is powerful patient education that can be done on behalf of the doctor to the patient, and the patient receives it on their mobile phones in a very simple manner. This improves their ability to absorb. Today, if you give large chunks of information, people are not able to absorb and digest it. Give simple, reduce medical jargon, make it as visual as possible, make it simple. This is the power of patient education. The second thing is, we want to educate the patients and support them on compliance. So we can give them medical instructions. So after surgery, before surgery, what are they supposed to do? Day in and day out, we find patients who come into surgery are not prepared. So can you imagine a patient is coming in for surgery on day -10. A message goes to them saying you can stop aspirin today or stop anticoagulants today. Start this medication on day 7. Day -3, they get a message saying you can have a shave or a bath or whatever. So, the night before the surgery, they can be told that you must have a bath before coming in. You should be nil per orum. That means don't take anything by mouth. Ensure that you don't even have a cup of tea. Ensure that you take your morning medications with a sip of water. All these things, if they come to the patient at 10 o'clock in the night and at 6 in the morning, they are better prepared for the surgery. Once they go home after surgery, you get so many instructions and so many questions patients have. We give them big chunks of data or on paper, but they don't really understand it. So just imagine on your mobile phone on day after the surgery, when you reach home, a message comes saying, today take rest, lie down like this, ensure that your head is up, etc., etc. Next day you say, today you can walk. Third day after surgery, it says you can now climb stairs. Or how do we look after your wound? Or what should I eat? Today you have only liquids. Day 3 it says you can have, you can start solids. What kind of solid? You can give them a meal plan. So just imagine doing this systematically these messages coming to the patient at scheduled intervals, and this is how the patient will be able to comply better, because now they are getting bite-sized information, easy to understand, right when they need it. Now, long term, so especially for NCDs, for example, you want the patient to come back for proper follow-ups. You need to give them reminders about taking medications on time. Ensure that patients exercise properly. So all those instructions can actually be given to the patient time and again as reminders. So you have a long-term relationship with the patient. Now, some patients have got serious diseases. Just imagine a stroke patient. You can actually provide a lot of support to them long term, like this. Cancer patients, cancer groups. So what I'm trying to say to you is, telemedicine is not just teleconsult. Telemedicine is about patient engagement, patient instructions, patient education. It's a big thing. So this is one big chunk of telemedicine that I wanted to present to you. There's another part of telemedicine, which is mass level screening. So, just imagine, there are certain specialties which actually manage this quite effectively. For example, there is this use case which says that you take an ECG machine with an ECG technician, put him on a bike, he goes from village to village and takes ECGs. These can be done, just 50 rupees or something. He takes the ECGs, simple ECG machine with a simple ECG that comes out as a printout, no heavy integration, etc. required, uploads the ECG into the system. It goes to the cardiologist. The cardiologist has a look at the ECG and will actually consult and give his advice. In case the patient needs to come to the cardiac center, they can be asked to come. What a brilliant system. You are doing mass level screening, picking up patients who require further treatment and managing it at low cost. Very effective. Now, of course, you can make it more complex by putting in an integrated ECG machine, putting in some AI logic which will screen the ECGs and only make sure that only the ECGs which are abnormal come to the doctor. But that is really not needed today. That's when you are doing 10,000 ECGs in a day. If you are doing 50 ECGs, I don't think that's a burden, that you don't need an AI or a machine learning for this. Yes, it is a good thing, but is it really needed today? So imagine doing these things. Imagine doing mass level screening for diabetes. You put in a diabetic retinopathy. You put in a diabetes camera, take the photographs of the retina, upload them, and a specialized retinal surgeon can actually have a look and give you advice. So this is another kind. Then you can do so many things like cancer screening. So, the use cases for screening will vary from disease to disease and what you are actually screening for. Net, what I'm trying to say is, telemedicine can be a powerful way to screen large populations for different kinds of diseases. I was talking to one of my colleagues, who's a very senior bureaucrat in the health ministry, and he was struggling with the fact that, we are not able to identify high-risk pregnancies in the common public. So that itself is a problem. So how do you identify high-risk pregnancies? And then ensure that those women who have got higher risk, for example, twins or hypertension or diabetes, are actually given better care. So systems like telemedicine can actually ensure that not only do you screen them properly, but you also continue to monitor them. So the next part that I would like to talk about is monitoring. So monitoring is at different levels. One basic level of monitoring is to ensure that patients, especially who require monitoring, that basic symptoms and their basic vitals are maintained. So you might say that I would like to monitor the blood pressure of a patient twice a day, or blood sugar, or I would like to monitor their symptoms. Heart failure patient, I would like to see whether they're getting breathless or just their weight. We know that heart failure, just if you gain weight over the last 2-3 days, is an indicator that the patient may be having water retention and may go into failure. So you can have a monitoring of as simple as weight, blood pressure and things like that, which is basic level monitoring in a dashboard. So every day the patient puts in their parameters, and in case it goes up, and you can build in some alerts, there's an alert that comes in, and the patient can actually get some warning that there is a problem. They can consult with the doctor on the system, and in case the doctor is comfortable, they can get treated from home, or the doctor can call them to the hospital. So just imagine picking up complications early because of basic monitoring. This is what we say, dashboards that can be created for non-communicable disease. At the highest level, you can have real-time monitoring of patients, where you put in a ICU grade monitor at the patient's home, and you can pick it up on your mobile phones, and people can have a look. So monitoring of patients is a very big element and a very big use case for telemedicine. Unfortunately, there's not much work happening there, but this is the future. This is where we combine the teleconsult, the mass screening and continuous monitoring over a period of time to keep the patients healthy. So this is the element of monitoring. So we've covered the different elements of telemedicine. One, we said it's about teleconsult, and we went into greater depth into teleconsultations. Then we talked about patient engagement, and we talked about more about education, instructions and better compliance. Now we talked about screening. Last but not least, we talked about monitoring. Now to conclude, one area that doctors keep asking is, which is the best platform? How do we choose, which mode to use for teleconsults? So my clear suggestion is, there are 3 or 4 areas under which you will evaluate a teleconsultation mode. 1, is it user friendly? Number 2, is it economical? Number 3, does it help you to comply with MCI guidelines, and does it keep you legally free and legally protected? So let's look at the 4 major ones that we have. The first one is an audio call. In a telephonic call, very easy to use, quite cheap. Unfortunately, these are the only 2 pros. The cons are a big lot. Does it help you to record consent? No. Does it help you to create proper records so that they can be produced in court? No. Are the records editable? Yes. Can they be tampered with? Yes. So they will have no real value in the court. Last but not the least, can you prescribe legally? Not really. So all these things ensure that may be easy to consult, but basically the doctor is seriously vulnerable because they are violating the MCI guidelines, and in case there is a problem, they can be in case there is a complaint, they can be in serious legal issues. When you come down to the second mode that people use is what we call video calls. So you can use a WhatsApp call or a Skype or Zoom. Again, the same principle. It is slightly better than an audio call. However, the problem lies with record maintenance, consent, legal prescription, and the ability to produce this whenever required. So better than telephone, but still keeps the doctor seriously legally vulnerable because you're actually violating the guidelines. Third thing that people use quite frequently is a chat system. Now, do chat systems, are they effective? Very easy to use. But can you identify the patient or the doctor? Not really. There is no record for identification. Can you prescribe legally? Is the prescription legal? Not really. Can you maintain this record? Not really. Can you see X-rays and reports and then put them in the same record? Not really. So again, chat is probably the worst of them all, because you just don't have any records properly, which you can produce in a court of law, or in case an authority wants it. So precisely these are the problems with telephone, video calls and chat systems. So ideally, if you are serious about telemedicine practice, you should actually choose a RISE platform. A good telemedicine platform will have the following. One, it will allow you to do a video call. Video call means that you can actually take verbal clues from the patient. You can actually see skin lesions. You can actually see the wound. You can take photographs and do a lot of things which you can't do over audio and chat. Number two, the system should ensure that you are able to be identified properly. Number three, you should be able to take a consent automatically and record it. Number four, you should be able to generate a proper legal prescription. Last but not the least, the system should keep all these records in one place so that you can also access them, and in case you need to show them before an authority, you can do so easily. So choose a e-platform system or a telemedicine platform which helps you to not only make it easy to consult, but also ensures that you are legally secure. So this is the advice that I give for this kind of stuff. Now, last but not the least, let's conclude. So we have covered what exactly is telemedicine, where we said that telemedicine is basically the use of digital and communication technologies to actually treat patients and manage them from home. Telemedicine is not e-commerce. Telemedicine is not supplying medicines or supplying tests. Telemedicine is a serious medical practice. That's the first part. Telemedicine is not just e-consultation. Telemedicine is about patient engagement. It's about screening. It's about monitoring. So telemedicine is a far bigger and more comprehensive practice than just consults. Then we said we must choose the right platform. Be very careful about what we choose. And last but not the least, we have to ensure that we know how to use it, which is specific to specific specialties. A nephrologist, cardiologist, surgeon, all of them can use telemedicine very powerfully, except that they need to use it according to their specialty. So they have to modify it. So as a doctor, I can pick up a stethoscope or an ultrasound machine or a laparoscope and I can use it. But the laparoscope doesn't tell me how you can use it. You see, I just use the laparoscope the way I want to, and then I innovate. Similarly, technology is just a tool, but telemedicine is a serious medical practice, and that's something that I hope that I've been able to clarify. Thank you very much for listening to this session. My best wishes to all of you. Thank you.